Good morning, I'm Vic Senese. Welcome to UroNurse News. Today we explore new insights into male fertility and surgical intervention. Researchers have recently reported on the impact of microsurgical varicocelectomy, a procedure used to correct varicoceles on sperm function and birth outcomes. Varicoceles, which are enlarged veins in the scrotum, are a common cause of male infertility. A new retrospective study reviewed 260 men who underwent microsurgical subinguinal varicocelectomy between 2019 and 2024. Of these, 46 men had detailed pre- and postoperative assessments, including semen analysis and sperm capacitation testing, using the CAP score system. What's the CAP score system, you say? Great question. It's short for Sperm Capacitation Score, and it's a lab test developed by the Androvia Life Sciences that measures how well sperm undergo capacitation. Boy, that's hard to say. A natural biochemical process sperm must complete before they can successfully fertilize an egg. Capacitation is just like the final prep step. Sperm need to become fully functional. Without it, sperm may reach the egg, but they can't penetrate it. A varicocele is basically like a varicose vein, but instead of being in your legs, they're in the scrotum, the sac that holds the testicles. This causes blood to pool, leading to increased pressure and heat around the testicle. And as we can see from this picture, surgical repair restores the vein to its normal size, which will then improve fertility. The primary focus of the study was to determine changes in sperm capacitation, a measure of sperm's ability to fertilize an egg. Secondary measures include conventional semen parameters and probability of generating a pregnancy, and actual pregnancy and live birth outcomes, what really matters. The results are promising. Following surgery, median sperm concentration increased from approximately 22 million per milliliter to 30 million per milliliter. Total motile sperm counts improved from roughly 34 million to nearly 50 million. CAP score percentages rose from 23.6 to 27.7%, indicating improved sperm capacitation. The probability of generating a pregnancy also increased significantly, from 27.4 to 34%. Among 33 couples actively trying to conceive, nearly 73% achieved a live birth or ongoing clinical pregnancy after these varicocelectomies. More than half of these couples utilized in vitro fertilization, while those with normal postoperative sperm concentrations and a CAP score had a 60% chance of conceiving naturally or via intrauterine insemination. The study highlights that significant improvements in sperm parameters and capacitation can be observed as early as 3 months after surgery. These findings suggest that men with clinical varicoceles can not only improve their fertility potential, but also have meaningful chances at natural conception when their post-surgical sperm parameters are normalized. Experts caution, however, that individual outcomes may vary and assistive reproductive technologies may still be necessary for some couples. Nevertheless, microsurgical varicocelectomy appears to be a valuable tool in addressing male infertility and optimizing reproductive outcomes. That's the latest on male fertility and microsurgical varicocelectomy. For more updates on urologic research and patient-focused news, stay tuned to UroNurse News. Now, tomorrow on UroNurse, uronurse.com, bladder exstrophy. It's rare, but life with it is powerful. Join me as I sit down with Thomas Exler, Vice President of the Association for the Bladder Exstrophy Community, and a patient himself, to share his inspiring story, struggles, and triumphs. That wraps it up for today's episode of UroNurse News. For more updates on the latest research in urology and patient care, don't forget to like, subscribe, and share. Thanks for watching. See y'all next week.
UroNurse News, your daily guide. Healthcare stories we bring worldwide. Tips and updates straight to you. UroNurse News, keeping care in view.